So welcome everybody. I will be the facilitator of this discussion group, but we'll wait for at least a minute or two, just to be sure that everybody who wanted to be here joined. I know that we are waiting for Alyosha also. And then we'll start.
So yeah, I have the slides ready and can take notes. Let me know if you want me to share the screen, or if you prefer, I can share the screen so that the questions are up, and then unshare for the discussion, and then I can share at the end to make sure everybody that I took the right notes and everybody's happy with what we're going to share.
That would be great. I will share my presentation, and after I've finished, you can share your screen and share the notes. That would be great. Thank you. So, Alyosha, can we start? Okay.
Floor is yours.
So, okay, thank you. And welcome again, everybody. I'm Ksenia Krstic. I'm associate professor at the Department of Psychology at the University of Belgrade. But today I'm in the role of FHI 360 local consultant for implementation research in Serbia. So I will start with my presentation. Why this Zoom looks different every time? I don't see. There is the so sorry. Okay, so you should see my presentation right now. I will turn off my camera just while I'm presenting, because I'm getting notification that my internet is unstable. So just to be sure that everything goes smoothly. So as I actually as Alyosha introduced me, I will present something. I'm not promising results, but I will tell you something about implementation research on playful parenting in Serbia. So for the beginning, implementation research is a field of study that focuses on understanding how programs, policies, or interventions are introduced, and how are they applied or sustained in the real-world settings. So it aims to examine the process of implementing these interventions, identifying what works, for whom, and under what conditions. This research is critical for closing the gap between design of a program on one side and its practical application on the other, ensuring that evidence-based interventions achieve their intended outcomes in practices. So this implementation research that I'm talking today about started in early 2020 and is conducted by FHI 360, which is international research organization working as a learning partner for LEGO Foundation. As you know, LEGO supports implementation of playful parenting programs in several countries. Although somewhat different programs have been implemented in these very different countries, the goal of implementation research is to generate evidence on how programs can be successfully applied, how to expand the reach of successful programs to a broader population or to different geographic regions, ensuring that more families benefit from the interventions, while in the same time ensuring sustainability of introduced innovations. Finding of implementation research provide empirical evidence to help donors or implementing organizations make informed decisions about scaling up effective parenting interventions. By using data-driven insight, these stakeholders can assess which interventions are most successful and determine how to expand them to broader population. In that sense, this ensures So implementation research ensures that resources are invested in programs with the greatest potential to benefit families and children. This research has very complex design, encompassing several research questions at different levels of program implementation, from broader social context to the outcomes and effects of the program at the level of families. Additionally, data for each research question were collected from various sources and using different research techniques, as you can see in these blue blocks. So from interviews, focus group discussions, surveys, questionnaires, observations of the family, observations of patronage works, child assessment, and cost analysis. As I mentioned, I will present just a bit from a huge pool of data, just so you had like an overview or insight about kind of the result that implementation research can give us. So, for example, from the stakeholder interviews regarding the environment for ECD and playful parenting in Serbia, we identified several strengths and weaknesses. For example, to begin with, there is an established framework of national policies that support families and children, along with ongoing capacity building and investments in the ECD sector in Serbia. Additionally, there is intersectoral cooperation, as Sonia mentioned, at both local and national levels, and a noticeable shift in awareness and focus among key local actors. You already heard from Sonia's presentations that local government budgets have allocated funds for family support and various initiatives have been implemented. She mentioned more than 100 measures to address the identified needs of families. However, there are also notable weaknesses. There is a shortage of professionals, including patronage nurses, pediatricians, speech therapists, child psychologists, and social workers. And furthermore, current regulations and documents defining the scope of work for certain professionals, particularly home visiting nurses, presents additional challenges. Further, from the focus group discussion with parents, which were aimed at discussing the role of the father, we gained some insights about how they perceive the role of father in the family. When it comes to direct care, fathers often engage in activities such as play with the child or bathing. In some families, fathers share childcare responsibilities, well, fairly evenly with mothers, while in others, they assume a more supportive role. So they don't engage in childcare, but just supporting mother in providing childcare. Interestingly, fathers tend to be more involved in playing time compared to other aspects of childcare. From financial perspective, fathers are typically the primary earners, which creates expectations for them to provide materially for the family. As a result, many reported having limited time to spend with their children. In terms of discipline, they're often seen as a primary disciplinarian. So mother is responsible for childcare, but fathers are the one who should discipline the child. Finally, as a part of our observation of the work of patronage nurses and the implementation of the program in their daily work with the families, we noted significant improvements over the course of a year in several key dimensions of service quality. So just to mention a few of the key dimensions, we see that the patronage nurses have been much more successful in introducing and explaining the importance of play in the daily routines of the family, in demonstrating and modeling parental behavior, and in explaining the benefits of such interaction between parents and children. In summary, the key findings from the playful parenting implementation research highlight several strengths and, of course, some barriers. The findings highlight that the crucial role and positive impact of advocacy for parenting program. This advocacy has raised awareness among all key stakeholders regarding the need of families and parents, making them more willing to support these programs within their capabilities. Furthermore, intersectoral cooperation has proven to be an effective means of enhancing the quality of service provided to families, ensuring that they receive the necessary professional support promptly and with minimal confusion. Sonia also mentioned something about that. Then a significant advantage of implementing the Playful Parenting program in Serbia is the reliance on the already existing network of professionals, which can ensure its applicability, broad reach, and sustainability of innovations. Professionals involved in the program report excellent experiences with horizontal exchange of knowledge and skills, leading to noticeable improvements in their work quality and benefits for families. On the other hand, the research also highlighted some barriers to the program's implementations. These include, let's say, inertia or slowness, or maybe even unwillingness of national level institutions to adopt and support the necessary innovations. As you, I suppose, in each country is similar, but legal regulations are not very flexible to accommodate the innovations, and necessary changes to regulations are very slow to happen. This is also linked to a shortage of professionals, which is particularly noticeable in smaller and poor regions and municipalities. The improvement in services provided by professionals partly depends on their motivation and enthusiasm to implement this program, and it's not accompanied with adequate incentives, but it is accompanied with significant work overload. Widely accepted and somewhat traditional social norms can also be a barrier for program implementation, as well as outdated curricula in initial practitioner education. And finally, we can draw some conclusions about implementation research itself. This kind of research offers several key benefits that enhance program effectiveness and sustainability. It provides real-world relevance by offering insights into how programs operate under actual conditions, ensuring findings are applicable across diverse environments. It also reveals how program can be adapted to different contexts, helping to then identify what works best for various populations. Additionally, research identifies barriers and facilitators to program success, such as resources, constraints, and stakeholder resistance, while highlighting at the same time enables like strong leadership or community support. Also, implementation research improves program effectiveness by optimizing components that work and assessing the feasibility of scaling programs to broader population. Stakeholder engagement is another significant advantage, as involving stakeholders fosters ownership and their partnership, and increasing the likelihood of successful program adoption. On the other side, barriers in implementation research range from real-world complexity and resources limitation to methodological inconsistency and insufficient stakeholder engagement. Addressing these gaps will require more standardized frameworks, better funding, long-term focus, and inclusive strategies that take into account diverse contexts and population. And that's about what I prepared for you today.
Thank you, Ksenia. So I think now we can invite participants to ask questions or reflections. And then I think Maya will follow up with around the questions. Perhaps you will put up the slide. Would be easier, no? But yeah, any immediate reactions or additional questions you might have for Ksenia? Yeah, Nancy.
Yes. Hi. Can you hear me?
Yes.
Yes.
Okay, great. Thank you. Thank you, Ksenia, for this very insightful presentation. I have actually a question regarding the monitoring aspect of the program, given the amount of municipalities that were delivering the program. So what was the mechanism that you used in order for you to look at from one side, the workforce development, but also delivery of program, the frequency of delivery, the enrollment of parents, demand generation, etc. If it was done at the level of the municipalities, how were you able to monitor and collect data from all of them, like real-time data from all these partners?
Okay, thank you for this question. But my answer would be very long and very complicated, so I will try to keep it short. The main point that you have to have in mind is that the program in Serbia is implemented through already existing services. So patronage nurses who already work with families, preschool teachers who already work in preschool institutions with teachers. So those professionals were trained within the Playful Parenting program, and they started implementing this program in their everyday work. So when we targeted professionals, we of course knew who finished training, and then we work with them through surveys, through observations, through interviews and observations of their work. But when we wanted to see the outcomes at the level of families, that was very, very struggling, actually, because we couldn't, having in mind additionally ethical considerations that we cannot target the families we cannot get the contact of the family based on their based on patronage nurse visits. So we actually data were collected through snowball method. So we just randomly selected families with the children up to 3 years old, and then asking them about what they heard, did they receive patronage nurse visit, or if they are enrolled in kindergarten, if they are what do they know about Playful Parenting program in their preschool and things like that. So, I cannot address each of the aspects that you asked because I'm afraid it will be too long. For some data, we get data from patronage nurses about how many families they visit, for how long, what do they cover in those visits. But as I said, that is considering their work, but at the side of the families and the parents, we just collected a random sample of families, data from random sample of families in those municipalities where the program is implemented.
Okay, great. Thank you.
You're welcome. So, Boniface, do you want to comment?
Just to add a voice, and thanks, Sanya, for responding to Nasa's question and also for the details in your presentation. And Nasa and the colleagues, just to add that the way this was designed, and again, credit to the Lego Foundation, bringing FHI 360, and the way we have operated is to take the learnings and also incorporate as we implement. So throughout, the journey of the implementation, FHI have been coming to say, okay, there's this parameter, and this is what we are getting as feedback. And now us as, UNICEF and the government in Serbia incorporating those lessons. That's why you saw that slide that showed, the improvements in terms of the observations and the like. So the monitoring, in addition to what Sanya has said, it was also more like taking those lessons and immediately addressing them. And I think I like the word implementation in research. I think that's what we tried to demonstrate, so that it's really implementation, but also learning at the same time, so that we can improve the programming. And allow me also to elaborate the advantage of working with the national systems. We did not create any other external workforce, but ensuring that it's part of their routine. And I think we also saw that as the game changer, because if you create additional workforce, they may be detached from the government system, but ensuring that that is already incorporated within the system. So the monitoring was done within the routine of government, in addition to what FHI was doing. So I think I just wanted to add those 2 points, and thanks.
Yeah, thank you,
And
Boniface. And perhaps, just before Ksenia jumps in, perhaps Maya, you can add to this effective strategy and solutions also, like building on, you know, existing workforce in, you know, because this showed to be an effective one. Ksenia.
Yeah, I just want to follow on what Boniface mentioned, because research actually followed the implementation of the program from the beginning. So research started in the 2020 in the first 5 municipalities, which were pilot municipalities for the program. In the next phase of the program, next year, the program scaled or extended in additional 29 municipalities. So also research then was extended to include the sample of those 29 municipalities. So it wasn't conducted in all 29 municipalities. So, and each year we repeated several methods actually, so from observation, interviews, surveys, and in that sense we could inform implementation organization about what's going on the field and what are the immediate effects of implementation program.
Great, yeah, and I see that Maya has a timer, so we still have like 7 minutes in the small group. So we do have some effective strategy already listed. So there are still some pending actions to be mapped out, and also knowledge gaps related to whatever discussion in this small group was. Any reflections, feel free to unmute yourself, add.
Hi, I'm very curious. So what I work with a parenting program in South Africa, and one of the things that we always struggle with is how do you know you're getting it right? Like what changes are you effecting, and how do you measure those? So I would be really curious to see to hear from you. How did you cover that? Thanks very much.
Well, that's a hard one. I'm not sure that we know that yet.
That makes me feel so much better. Thank you.
Well, I'm glad that at least I succeed in that. Again, the important part of the program in Serbia is that it's through the system. So if you want to make a change through the system, you have to be very patient. So we expecting the change to be more like obvious and visible with the time. So since the program was implemented through phases, starting from 5 municipalities and then expanding, and the number of professionals who were trained and start implementing was expanding through the phases. So we are still waiting for like critical mass of professionals to be involved, to be trained in this program, to be sure that the effects of the program then and the innovation itself will then work, like nobody succeed better than success. So when others see that this program and innovation is successful, then through horizontal exchange and training of other professionals, it could be expanded and scaled up further. So how do we know that it works? There are some indicators measured at the level of families or at the level of families, or at least at the level of professionals, that we see that something is changed. But as I said, we still need more results to be able to certain that is that made changes.
Thank you.
Jill, and then we have Nancy.
I was just going to come in as the funder on that question and say, I used to think that it meant that all of these programs go to scale with quality, and at the government level, if appropriate, there's uptake and funding, and that was that would be a really nice story to tell. But I think what's also important in terms of having that goal is also, I think, what Christiania was sort of alluding to, that we have these smaller indicators or smaller things along the way that tell us we're on the right path, so that we may not achieve that end goal, but we may take longer to get there, but at least we've chipped away at it, and that we're making progress, because this just takes time, especially if you're talking about systemic change. So I think having those little things as well as this big goal is important. I don't know if that's helpful.
Yeah, and then we
Thanks,
have
that's very
Nancy, but then we also have still knowledge gaps, spending actions, and effective strategies. I see that Maya is doing a great job in trying to summarize whatever we are discussing. Go ahead, Nancy.
Yes, thank you. Actually, I wanted to build in on Jimena, right? Jimena's question. And do you consider measuring your theory of change based on maybe mere simple pre and post evaluations, or maybe conducting some, I don't know if FHI 360 is interested in conducting a randomized controlled trial just to compare between groups of parents who take in the program, because I'm also very much curious to actually see what are the indicators that told you it's something successful to bring it to scale.
Okay, so I could send you more about the methodology of the research, because it was very complex. As you can see, it's longitudinal is the design of the research. Then we had experimental and actually program and control municipalities in which research was conducted. So it wasn't real pre and post test experiment, but because it was in the real setting, so we could not conduct experiment in that sense, but there were a lot of indicators that were measured, and one of the problems with the final results is that those indicators measured at the baseline were already very high. So, for example, family environment, child assessment outcomes were very high. So we actually had the ceiling effect and couldn't get enough, difference in the after the program measurement to show the effects of the program in that sense.
Thank you. We had the same issue before.
Yeah, no, I'm just chatting with colleagues, so we might extend the time. So we will then try to be in the small groups until 2:35. So which means 10 more minutes, something like this, so that we can continue the discussion. I'll just fix this. So go ahead, Boniface.
Okay.
Thanks, Arios. I think you have been so kind, because the conversation is very rich. I just want to also to build on what Jill mentioned, and Nancy also trying to attempt to answer what you asked. Just also to elaborate that there is also the dimension of quality. So 360 FHI was trying also to help us to see if we are doing it right in terms of quality. That's the delivery of the service. but you are also bringing in the dimension now of the outcomes, which now I think Sanya has indicated in terms of the indicators that they have been tracking. So I just want to elaborate much on the quality, because we are asking ourselves that question to say, is the program at the level of the desired quality that it can be scaled up? So I think that's the other thing that we have been. So that's why you see the checklist on the observations is to ask the home visiting nurses doing things when they go to the home in line with the checklist. So that is more like on the quality dimension, so that we can improve the delivery of the service itself. So as Jill indicated, we may not be there, we cannot claim that we are there, but we have a roadmap, we have a package which we know, and we can have answers in in some areas where we have defined the parenting, and the way to do business. And it goes back to also what South Africa was asking, to say globally we are that kind of crossroads, because there are many questions. But in this Brave Parenting program, I would say we have a prototype. I think that's the way that I can use. We have a prototype that we have more like tried to improve, but it's worth also more like continue doing the work, so that when we talk of scale, we don't repeat some of the things which the evidence has told us maybe we don't need to do that way, but you need to take a different path altogether. So I just want to highlight that there's the quality dimension, which we have been trying to incorporate as much as possible, and also now measuring the outcomes. And we are learning away from the word evaluation. So it's not an evaluation, but you can have now the learnings, so that they can also inform future programming. I don't know if it's making sense, but I just want to highlight those two dimensions. Thank you.
And I have to add just one more thing, because I was talking about implementation research in general and presenting some concrete data, but I didn't talk about all very specific and concrete struggles that we have conducting implementation research in Serbia. For instance, when we are talking about the fidelity of the program, theoretically, you just observe the quality of service that is delivered, but in practice, in real life, you have to find the patronage nurse who is willing to accept a stranger, a numerator or evaluator, to observe their visit to the family, and of course to find a family which will accept that kind of observation. And that is becoming more and more problematic in Serbia. We are very untrustful to the people. I don't know, to conduct research in Serbia is very, hard work. So I'm just trying to explain that even with the design, the more comprehensive design of the research that was planned, we actually couldn't get all the data that were planned. So in that sense, we have still some those knowledge gaps between this implementation research could not give us all the answers that it was planned to do.
Now, just listening to you, Ksenia, like going to those pending actions in terms of implementation research and some evidence that would back us up in terms of implementation of the certain programs. Do you think that perhaps we are also, as societies in general, reaching to a stage where we will have to rethink how we conduct research in communities?
Yes, I don't have a solution. I don't have idea what we could or should do. And as I said, especially in Serbia, not just in this research, but that's something obvious from different researches we are conducting here. It's becoming very hard to get really representative sample of participants of any kind of, however you define the population you want to research. So yeah, we have, as a researcher, we have to think about the next steps, next level of research.
Yeah, no, it's amazing to hear, because we did last year research on a community research on the status of young Roma children, for example, as well. and it's together with University of Barcelona, and it's also, you know, also going to marginalized communities, etc. So yeah, we faced also some challenges. It's not an easy. But yeah, it's a good point. So any other pending actions that we still have around the research, or perhaps some effective solutions, so that Maya can type?
So I can jump in a bit on the South African context. So we do a lot of work with communities, marginalized communities, difficult to reach communities, politically sensitive communities. So getting your foot through the door can be quite complicated. So we often find one strategy that works for us is to make sure that we have sort of the local chiefs or the local key stakeholders on board. So we really start off with a very comprehensive process of introducing ourselves, making sure that everybody's on board, they know who we are, they trust us, and then it slowly kind of filters to the rest of the community. So that's how we do it, just as an example. Yeah.
Somebody else? Any reflections? We still have like 8 minutes.
Can I ask a question of clarity? So this was a particular example of implementation research done in the Serbian case, right? Have you got examples in some of the other countries where the Playful Parenting program has been implemented? Because I'd be very curious to see the differences or the commonalities. Yes, that's interesting. Like what can we apply? What's context specific? That kind of thing would be interesting.
Yeah, well, the same research was conducted in 5 countries, so Zambia, Serbia, Rwanda, and Bhutan, and some some parts of the research in Guatemala also. So there are results that are presented to each of the country, and the final report, which will encompass all results from all countries, is finalizing. So in one moment it will be available.
I'll look out for that. Thank you so much.
No problem.
Yeah, but I think it's also the question that we have in many discussions on various topics, but I think it's also very relevant for playful parenting. I think it's also based on, I don't know, it might be mistaken, but just thinking, you know, how, let's say, regionally or culturally playful parenting is framed or understood, let's say. It can be, for example, like that one region differs from another, and there are still a lot of cultural differences in parenting styles, and, you know, not just parenting, but also like a whole family approach in rearing up children. So I think this also implicates a bit of how we,
Yeah, I could also add on that. It's not just regionally or on some major divisions between the families, but also within municipalities you can find variety of factors influences family capacity to interact with the child and to implement playful parenting. So one of the big questions for Serbia is about the model, whether if it's sustainable to support universal model of implementation versus targeted model. So to target the implementation of to the families who actually need more support from different professionals, or to keep it as universal program reaching all families that come to those all systems interacting with families. So that's also an important question in our context, especially again having in mind that the service delivery is through already existing systems, so it's already predefined how many visits patronage nurses have, for instance. So in each family, when those visits happen. So that's also one big issue.
So now I'm looking at Maya. Do you think we have enough input, or would you need some more input from us?
Well, it's as much about quality as quantity. So maybe it's a chance to take the last couple of minutes and see, is there anything on here that's not clear or that you disagree with? Or is there anything else you wanted to just throw on there?
So there, Nancy raised a hand, so right.
Oops, sorry, I was on mute. I have a question actually related to the demand side. Based on the research that you have, do you have any insights on how to effectively reach and motivate parents to participate in the program?
Well, we have a very, very hard question. Well, no. We can you sorry, can you repeat your question again? I get lost in my
Yes.
thoughts.
Yeah, sure. Yes, sure. So whenever we're like designing a parenting program, usually we are very much focused on the supply side and training the practitioners or the workforce who will deliver the program, the quality of the program, monitoring, evaluation, quality assurance, etc. And your colleague Sonia, I think, yeah, she mentioned that you did the communication in SBC communication and outreach to in parallel of the delivery of the program. That is, I'm assuming she was talking about targeting parents. So did you learn through the learning, I would say, like through the learning of implementing this program, were you able to understand more what motivates parents to participate in this program, or how to effectively reach parents?
Yes, so why I get lost is because for me it's very hard to divide, what I know from the implementation research and what I know as a psychologist and parent living in Serbia. So that's why, I would have to tell you the whole story about what means to be parent in Serbia. So demand side is still underestimated because parents still don't actually know what they need. So we first have to raise the awareness of parents about what parenting should be and what support they actually need, so that we can say anything about demand side. But what Sonia was explaining or talking about is that at every municipality level, they conducted a research which aimed at mapping existing resources and also what is needed, but that was more at the level of institutions. So what patronage nurses or pediatricians need, what social workers need for their interaction with parents. And to answer directly how we managed to engage parents, so as I mentioned, professionals are already working with parents. So we have patronage nurses trained within the program, and they're visiting families. And with families, they assess the whole family situation, the context of the family, and they assessed when and how to introduce playful parenting in their interaction, in their service delivery. So they demonstrate and model parental behavior in order to improve how they parent their child. So if they succeed and how they succeed, that depends on a lot of factors. Okay, it's time up. So there is a lot of layers of the answer to your question. So I'm just trying to give you just some bits.